My name is Sean Van Velsen, and I'm an accredited exercise physiologist working in private healthcare here in Melbourne, Australia. Today I'm going to be talking and justifying active therapy and exercise for Newman's Peak Type C patients and sufferers. So exercise is our medicine, and we advocate to our patients that this is how it should be treated. So we've all been told by doctors and specialists that we need to be more active and engage in more exercise, but essentially this is quite a broad recommendation. And given all the benefits now, these medical benefits that we're starting to see from exercise, having a professional such as an exercise physiologist is really helpful to give a tailored and individualized recommendations and programs to suit people that aren't able to just hop on down the road and join the gym. So we're starting to see exercise being used in many debilitating chronic conditions such as, end-stage osteoarthritis and people who've had strokes and recovering from heart conditions. We're giving exercise to people who are on chemotherapy for cancers, type 2 diabetes and chronic pain. So it has many benefits across many different facets, and I think unfortunately it's been always historically viewed as just a way to lose weight. And as we get into this, you'll be able to see that it's so much more than that, and it really covers all aspects of health. So the important thing that I'm going to talk about next is that while we can't go a lot of research on Newman's big type C, given our population is so small, it's really hard to get studies with scientific rigor given the numbers that we're using. We can use similar neurodegenerative conditions and look at the benefits that exercise is having in that realm, and then we can apply it to those suffering via the symptoms. So some of these research highlights that I'm talking about are listed here, but as an overall base, we know that exercise improves physical strength, balance and gait, physical fitness, and the functional capacity of patients that engage in them. And some of the highlights can really answer some questions as well, I think, that we get from normal people. So exercise training was shown to improve, obviously, these variety of physical outcomes I just mentioned, but with no adverse effects on spasticity or abnormal movement and these other neurological symptoms in children with cerebral palsy. So the age-old sort of concern of parents is that, oh, well, isn't weightlifting and exercise potentially harmful for my child, especially one with a serious condition? And the answer is no, is equivocally no. We know that it actually improves their physical development. So that sort of ticks that box straight away. The second highlight was that exercise was shown to slow the process of the disease and protect against the onset even in patients with Parkinson's and Alzheimer's disease. Now this hits home quite well within this population, as Newman's Pick type C has often been referred to as childhood Alzheimer's. So the idea that a natural therapy such as exercise can slow the process of the disease is incredibly powerful, and I'm sure of a lot of interest to the families and sufferers of the condition. Moving down, we've got exercise now is shown to stimulate the growth of new cells, so this neurogenesis in the hippocampus, which is a really important part of the brain linked to cognition and emotions. And we see this improving with regular exercise. So the idea that the body is this bioplastic organism that can adapt to stimulus that's given to it and actually improve it for the better is really exciting. And it's relatively new research, but we see it with great success in some other neurological conditions, particularly people are suffering from strokes. We see, hands that aren't moving go to, back to near full function. So some really exciting stuff in there. And then we've also got exercise to start improving positive behavior in dementia and those with cognitive impairments. So this sort of relates back to the other aspects of health. So not just physical function and capacity, but also the mental side of things. We know exercise is incredibly powerful for those with mental health issues, and this can play a really big role in improving the quality of life, not only of the sufferer, but also of the caregiver as well. We know that stress is super high. So to be a bit more specific, there's types of symptoms in NPC that are probably linked to more appropriate exercise types. And I've sort of made some links here, with chronic issues in the muscle, so hypertonia, dystonia, tremors. We know strength training and power exercises can be really beneficial. So we're trying to recruit the muscle motor neurons within the muscle with, things like auditory cues and maybe even visual cues, really trying to load that muscle up. And we have seen great effects of this in Parkinson's. We've got things like delayed motor skill development in the younger population. Obviously, the learning to push and pull and jump and catch and throw and all these sort of things that a healthy child would normally go through. Sometimes is obviously lacking in this sort of population. So some more task-specific stuff, particularly when we're talking about the next point with gait and balance. So walking, that specificity and targeting the muscles of the limb that is for whatever reason lacking, can by using this theory of bioplasticity, we can actually, by practicing a certain way, the theory is that we can grow these new nerve pathways and link this mind to muscle connection to actually improve their function. And getting down to the bottom point, with depression and anxiety, and which is linked really highly with people with these chronic conditions and disabilities, much more so than the healthy population. General exercise is shown to be fantastic for mental health, and it's even been more effective if it's shown to be half enjoyable. And I think this is a big point. Is not everyone's going to love exercise, but doing something in an environment where they like, whether it's music or movies or whatever it is that they will take notice of, adding some exercise into that environment might be really helpful. So some things to keep in mind is that, it is more effective the earlier we get them moving. It's less effective the later we start. However, it's still a point where everyone can do something and get these benefits. All right, so the dosage that we want by all guidelines is 150 minutes per week over 5 days. And this includes a combination of all those different exercises I was talking about before. These are obviously the guidelines and they're not the law. So I won't speak too much about the NDIS. That's an Australian thing rather than the UK. However, I do want to finish on these last 5 messages to parents and caregivers in that, number one, exercise is protective rather than harmful. We know, I mentioned before about the children, people being worried about whether it's going to affect them long term. We know that it's just not the case anymore. Exercise in all forms can really benefit the physical development and also the mental health of the sufferer. So please don't be worried or anxious about getting started. We know exercise is about making the most of what you do have rather than what you don't. So it's not focusing about, oh, she can't do this anymore or we can't do this. It's about, okay, let's change that positive mindset to look what we can do and really sort of utilizing that to not only for the mental health, but also just to keep engaging them in exercise. So schedule dedicated time for exercise and movement into your weekly routine is massive for just adherence. We know exercise is fantastic, but you actually have to do it to get the benefits. And we always say the best exercise program that we can give is one that you will actually do. So sometimes scheduling it in and having it come up from it's just part of the routine. It's a great way to just get it adhering to it in the long term. Engage and invest in good professional help. So I've listed some Australian websites here, but over in the UK, try and establish a network of people that are like-minded and experienced in dealing with these neurological conditions and have a good understanding of how exercise can help. And the last one is you guys need to exercise too, the caregivers, the parents, and the families. It's incredibly stressful dealing with someone having a family member go through this terrible condition. So, all these physical, cognitive, and social benefits, mental benefits apply to you guys too. So please take the time when your loved one is exercising, you can jump in there on the treadmill and get some Ks up as well. All right, thank you, and I hope you enjoyed the presentation.